I am Professor Azizur Rahman, and today we are going to start a series of lectures on congenital heart disease. Now, since I deal with adults, so I will be talking about congenital heart disease in adults. Now, what is the difference? The difference is that there are actually many congenital heart diseases which are not compatible with adult life. So I will not be talking about those conditions. So I think relatively less serious conditions, and especially those which were identified early and may be treated, they may be seen in adult life. So actually I have divided this section in different categories. We will be talking about first the introduction today, and then I will be talking about the classification of congenital heart disease. Uh, I will be discussing some common features of left to right shunts, which are applicable to all those conditions which are characterized by left to right shunt. Then I will be discussing common features of right to left shunt. Then, since these conditions are common, then we will be talking about separately on atrial septal defect, ventricular septal defect, patent ductus arteriosus, then miscellaneous disorders, and then I think finally we will have a quiz also. This entire presentation is divided into 8 or 9 sections. I think it is recommended that you watch all these videos in that sequence. So let's start with introduction.
Medurstand. Understanding medicine.
Uh, what is congenital heart disease? Any structural abnormality present at the time of birth. It may not be detected at the time of birth. Sometimes it may be diagnosed much later, and you may be surprised sometime at the age of 40 or 50. Sometimes person may be a professional athlete. That means he may be physically absolutely fit, but may have a congenital heart disease. So we know that this must be present at the time of birth by their pattern. And they are not rare, especially I think in the developed countries and in Pakistan also in good hospitals, every newborn is physically examined by a pediatrician. But in our country, many births take place out of hospitals, and a congenital heart disease may remain undetected and may be diagnosed anytime later. Now, depending upon what disease, it may be diagnosed early part of the life or maybe later part, but still we see fairly commonly these conditions. Etiology, whatever congenital disease you may talk about, there is no definite etiology, but there are a number of things we typically blame: viral infections, some teratogenic drugs, and some infections in the mother, exposure to radiation. Although hardly ever we actually document the actual exposure which resulted in congenital heart disease, but we usually attribute one of these. But ultimately, there is some mutation. There is some mutation which results in congenital heart disease. Now, since this is an aberration, there is a lot of variation. That means once something is not normal, the abnormality can take any pattern. So you would see a lot of variety in congenital heart disease also. Uh, Most result in prenatal or natal or postnatal death because they are so serious and the treatment required is not possible at the time of birth, so they result in early death. So they do not reach the adult life, so we don't see them. Majority. So what we see is actually the tip of the iceberg. But this is actually, I believe, nature's blessing that if somebody is to live a very, very handicapped life, if that infant dies in early life, that could be actually a blessing for the parents. It's hard to accept this fact, but this may be actually a thing, blessing in disguise. Now, to understand a congenital heart disease, you must understand fetal circulation. Now, if you have to understand fetal circulation, we first have to understand adult circulation. I'm sure you all know this, but since it is very relevant to our discussion, we have to discuss it here. So let's first take adult. So, in adults, our lungs are ventilating organ. So lungs oxygenate the blood. This oxygenated blood, coded in red, is brought to the left heart through the pulmonary veins. From the left atrium, it goes to the left ventricle, and then through aorta, it goes to the various parts of the body, including brain. And then it gets deoxygenated, becomes blue, brought back through inferior vena cava and superior vena cava to the right atrium, and then to the right ventricle. Then through the pulmonary artery, it goes to the lungs for oxygenation again. And please note down, these two circulations, left-sided and right-sided circulations, they are in series. Whatever blood passes through the left side has to pass through the right side also. And whatever amount of the blood passes through the left side, the same amount will pass from the right side also. So the left-sided, right-sided circulations are in series as far as their function, the physiology is concerned. But the structure of the heart, atria and the ventricle and the great vessel, anatomically speaking, they are parallel to each other. But at no point left-sided blood mixes up with the right-sided blood in a normal healthy person. The blood has to pass through the capillaries, only then both in the systemic capillaries and the lung capillaries to get to the other side. So this is important. So this is adult circulation. Now let's see what is the difference in the fetal circulation. In the fetal circulation, the ventilating organ in this case is the placenta. Now placenta is getting oxygen from the mother. The placental veins, they brought blood, the oxygen blood, and this is the venous blood but recorded red because this is oxygenated, is brought to the inferior vena cava and then to the right atrium. And from right atrium, instead of going to the right ventricle and to the lungs, it straight goes to the left atrium. Why so? Because lungs are collapsed in the baby which is not born, the fetus. The lungs are not ventilating, they are collapsed, and the blood does not go there. Instead, the blood goes through the foramen veil into the left atrium. So this is oxygenated blood coming to the left atrium and then left ventricle, and from left ventricle it goes to the rest of the body through the aorta. Now lungs are not ventilating, but they do require some oxygen, some circulation. So nature has provided a system of some blood shunting from the aorta to the pulmonary artery through the ductus arteriosus. So these two foramina, the foramen ovale and this ductus arteriosus, these two foramini, they close at the time of birth, because at the time of birth lungs collapse and the pressure in the pulmonary artery drops and the blood starts going to the lung from the right ventricle through the pulmonary artery, and because the pressure on the right side drops, so that leads to closure of foramen ovale as well as ductus arteriosus. So these two should normally close at the time of birth or immediately after birth. So from left atrium it goes to the rest of the body. So this is the difference. Sometimes this foramen ovale may not close, this ductus arteriosus may not close, or there may be some other abnormality which is keeping these foramen open to make the life possible. So these points we will discuss later on also, but I hope you got a reasonable idea what I wanted to say about the fetal circulation versus the adult circulation. The changes which occur at the time of birth, they are lungs expand, lungs start ventilating, and the blood circulation from the right side, instead of going to the left straight to the foramen valve, start passing through the lungs and then coming to the left side. So the congenital heart disease, in today's talk, I will just give you a brief classification. First of all, some congenital heart diseases may be characterized by a shunt. Shunt means abnormal communication between two sides, right versus left. Now, you know that in normal person, pressure on the left side is always higher as compared to pressure on the right side. Pressure on the left side system is high pressure system. So if you compare left atrium with the right atrium, pressure in the left atrium is higher. If you compare left ventricle with the right ventricle, the pressure in the left ventricle is higher. Now if you compare aorta with pulmonary artery, the pressure in the aorta is high. So that means since pressure on the left side is always high, if there is shunt between two sides, blood will always flow from left to right. I hope this point is understood. So if there is just simple communication between two sides, an anatomical defect between two sides, it would result in a shunt, and the shunt will always be from left to right. That means blood from the left side will go to the right and then will recirculate to the lung. But occasionally there may be a right to left shunt. You just cannot have a right to left shunt if you just have an abnormal communication between two sides. You need to have an additional abnormality, and that additional abnormality is an obstruction to the right-sided outflow. It could be at any level. It could be at the outflow of the right ventricle, right atrium, or right ventricle. So there has to be some obstruction in addition to abnormal communication to have a right to left shunt. So there is one such condition, Fallot's tautology, and we will discuss that later. And in the left category, left to right shunt, atrial septal defect, ventricular septal defect, and patent ductus arteriosus, three common congenital heart diseases, they come under this group. So these are congenital heart diseases which are characterized by a shunt. Then you may have some simple obstruction, and there is no abnormal communication between two sides. There's just simple obstruction. One very important condition is coarctation of aorta, where there is kink, there is some narrowing in the aorta just distal to the aortic arch, that would result in decreased circulation in the lower part, and this condition we will discuss later. So there will be no shunting, but there is just stenosis. Similarly, there may be congenital pulmonary stenosis. Pulmonary stenosis could be rheumatic also, but mostly it is congenital. So these two conditions are characterized by simple obstruction in the flow, no shunting. Then the third group of disorders, there are actually many. I have made a very short list. There may be other congenital heart diseases which do not have any shunt and there is no obstruction. For example, dextrocardia. The person with dextrocardia is absolutely normal if there is no additional abnormality. Although some people with dextrocardia, they may have some additional congenital heart abnormalities. Of course, there would be symptoms because of the additional abnormality, but just dextrocardia may be an incidental finding and there is no problem at all. So this is a classification, and in subsequent lecture we will be discussing these one by one. Thank you very much. This was a short video on introduction of congenital heart disease, and I would like to thank you for watching this, but please join me in my next presentation. And this was Professor Azizur Rahman again from Medurstand. Thank you for joining.